Hello, my friend. I'm Dr. Susan Parker, urologist and bladder health specialist. And today, I want to talk to you about something that quietly damages the bladder of millions of people every single night, without them realizing it. For years, many have been told that getting up several times to pee, having a weak stream, or feeling like the bladder is never really empty is just part of getting older. It's normal, it's age, you just have to live with it. But in many cases, the real problem is not age itself. It's a nighttime habit that seems harmless, even sensible, but over time trains your bladder to misbehave and robs you of sleep, confidence, and comfort. That habit is constantly going to the bathroom just in case at night and forcing your bladder to empty when it isn't actually full. It can look like this. You pee before bed, which is fine, but then you get into bed, feel a tiny sensation, or simply worry that you might need to go later. So you get up again. You sit on the toilet, push a little, a few drops come out, and you feel reassured. 20 minutes later, you're still awake. You think about it again. You decide to go one more time. And the cycle repeats. Night after night, year after year, you teach your bladder that it never needs to hold a normal amount and that every small feeling of fullness is an emergency. To understand why this is such a problem, you need to know a little bit about how a healthy bladder is supposed to work. During the day and night, your kidneys continuously filter your blood and produce urine. That urine collects in the bladder, which is essentially a muscular storage bag. The bladder slowly stretches as it fills. Inside the bladder wall, there are sensors that detect how much it has stretched. When the bladder reaches a comfortable capacity, they send a message up to the brain. I'm getting reasonably full. We should plan a bathroom break soon. That message is not supposed to be a panic alarm. It's meant to be a polite reminder. With a well-trained bladder, you can feel that reminder and calmly decide, I'll finish this TV show, or I'll wait until the next rest stop, or I'll go once before I get into bed. In other words, your brain is in charge. Your bladder works with you, not against you. But when you constantly respond to the very first hint of fullness by rushing to the bathroom, especially at night, you slowly reverse that relationship. You teach the bladder and brain that tiny amounts of urine require immediate action. The bladder starts to send signals earlier and earlier. The brain, in turn, reacts faster and with more anxiety. Over time, this becomes what we call an overactive bladder pattern. At night, this pattern is even more damaging. Your body needs long, uninterrupted cycles of deep sleep to repair tissues, support memory, balance hormones, and maintain overall health. If you repeatedly wake up and walk to the bathroom, even for small amounts of urine, you're not just annoying your bladder. You're fragmenting your sleep. You might fall back asleep quickly, but your brain keeps getting pulled out of those deep, restorative stages. Months or years later, you notice that you feel tired during the day, your mood is more fragile, your blood pressure is harder to control, or your weight is creeping up. It all seems unrelated to your bladder, but poor sleep can influence all of those things. Another layer to this story is fear. For many people, the just-in-case trip at night is driven less by physical need and more by worry. What if I leak in the bed? What if I don't get to the bathroom in time? What if I wake my partner? That fear is understandable. Maybe you had one embarrassing accident in the past. Maybe you grew up with parents or caregivers who constantly told you, always go before you leave. Or, I don't want you to have an accident in the car. Those messages stick. As adults, we replay them without noticing. The result is a bladder that is not being trusted, but constantly monitored and micromanaged. Think of your bladder like a child learning how to behave. If you never let that child practice waiting, If you rush to satisfy every tiny request, they never develop patience or self-control. In the same way, if you never let your bladder fill to a normal, comfortable level, it never learns how to stretch and hold calmly. Eventually, it becomes jumpy and reactive. It complains sooner. It sends stronger signals for smaller volumes. You may think, my bladder is getting worse with age, but often what's really happening is that years of just-in-case behavior have conditioned the system to overreact. There is another piece many people don't realize. Forcing out urine when the bladder isn't truly full can interfere with the normal coordination between the bladder muscle and the pelvic floor muscles. To urinate, the bladder muscle needs to squeeze, while the ring of muscles at the bottom of the pelvis relax. If you sit on the toilet and push or strain when your bladder isn't ready, you can confuse that coordination. Over time, that can contribute to a weaker stream, incomplete emptying, more urgency, and in some cases, even more leakage. Let's imagine a typical evening for someone stuck in this pattern. They eat dinner at 7 p.m., drink a couple of glasses of water with the meal, and maybe some tea while watching TV. Around 10 p.m., they go to the bathroom and pee. So far, so good. Then they get into bed at 10:30, turn off the light, and a thought pops in. I should go one more time, just in case. They get up, manage a tiny amount, and lie back down. At 11 p.m., still not asleep, they feel a vague sensation in the lower abdomen. It might be gas, it might be the bladder, it might just be awareness. Instead of breathing through it and giving the body a chance to settle, they decide, I'll just go again. Another little trickle comes out. By now, the brain has learned slight discomfort equals immediate bathroom visit. This may repeat at 1 a.m., 3 a.m., and 5 a.m. The next day, they feel exhausted and start to believe, my bladder wakes me up all night. In reality, their own habits and thoughts are waking their bladder up. Now, I want to be very clear. Going to the bathroom right before you go to bed is generally a good idea. Emptying the bladder once before sleep is a healthy, practical habit. The damaging pattern is turning the night into a series of repeated, unnecessary, just-in-case trips, often accompanied by straining to squeeze out a little more when there really isn't much there. That is the nighttime habit that silently ruins bladder stability for many people. So what can you do to start reversing this pattern? The first step is awareness. For a few nights, simply notice how many times you go to the bathroom between dinner and waking up in the morning. Don't try to change anything yet. Just pay attention. Each time you go, ask yourself, did I feel a strong, clear need to urinate? Or did I go mostly because I was worried or trying to prevent a problem? This simple question begins to separate real physical signals from anxious habits. The second step is to optimize your fluid intake timing. Many people make the mistake of drinking very little during the day and then catching up in the evening. That guarantees a fuller bladder at night. Instead, aim to drink regularly throughout the morning and afternoon, and then gently reduce the amount of fluid you take in 2 to 3 hours before bedtime. You don't need to dehydrate yourself, but you do want the bulk of your daily fluids earlier when you're awake and moving. Also, be mindful of drinks that irritate the bladder, like coffee, strong tea, and alcohol. Consuming those within a few hours of sleep can make your bladder more active at night. The third step is to create what I like to call your official bedtime bathroom visit. This is one purposeful, calm trip to the toilet right before you get into bed. During this visit, sit comfortably, place your feet flat on the floor, lean your torso slightly forward, relax your shoulders and jaw, and take a few slow breaths. Allow the urine to flow by itself. Do not push or strain. Give your bladder a moment to empty at its own pace. When you're done, gently stand up and tell yourself, that was my one intentional visit. My bladder is as empty as it needs to be for the night. Now comes the challenging but powerful part. Once you've gone that one time, commit to not immediately jumping up for every tiny sensation that appears as you're falling asleep. The first few nights, your brain may play all its old tricks. It will whisper, "What if you didn't finish? What if you have to get up in an hour? What if you leak?" Instead of obeying automatically, try this experiment. Stay in bed for at least 10 to 15 minutes when the first mild sensation appears. Breathe slowly. Notice whether the feeling builds into a true urgent need or whether it fades as your body relaxes. Many people discover that those first sensations are actually just awareness or anxiety, not a full bladder. With practice, you can gradually extend that waiting time. You might start with 10 minutes, then work up to 20, then 30. Each time you successfully delay a just-in-case trip without discomfort, you are retraining the bladder-brain connection. You're teaching your body that it's safe to hold a bit more, that not every whisper from the bladder requires instant action. This is not about ignoring strong signals or holding urine for hours in pain. It's about giving your system a chance to rediscover a healthy capacity. Relaxation of the pelvic floor also matters. Many people clench their pelvic muscles at night without realizing it, especially if they are anxious or worried about leakage. That constant tension can actually increase the sensation of needing to pee. Before bed, you can practice a simple exercise. Lying on your back, place one hand on your belly, breathe in gently through your nose, feel your abdomen rise, and as you exhale, imagine the muscles between your sit bones softening and melting downward. This is the opposite of a Kegel. It's a letting go. Doing this for a few minutes can signal to your bladder that it doesn't need to be on high alert. Of course, there are important exceptions. If you experience burning when you pee, blood in the urine, fever, severe pelvic pain, a dramatic change in how often you urinate, or an inability to start the stream, you need to speak with a healthcare professional promptly. Those may be signs of infection, stones, obstruction, or other medical issues that require specific evaluation. If you have diabetes, heart failure, neurological disease, or a significantly enlarged prostate, your bladder habits need to be tailored to your situation with professional guidance. The strategies I'm sharing with you are educational and general. They're meant to help you understand and improve habits, not to replace medical care. Let me share an example from my practice, with details changed to protect privacy. A woman in her early 70s came to see me because she was waking up 4 to 5 times a night to urinate. She was exhausted, frustrated, and had stopped traveling because she was so focused on bathroom access. After ruling out infection and other medical causes, we talked about her nightly routine. She told me she would go to the bathroom after dinner, again before watching TV, again during a commercial, once more before brushing her teeth, once right after getting into bed, and then often 2 more times within the first hour of lying down. Most of these trips resulted in just a tiny amount of urine. She was living in constant fear of not being completely empty. We worked together on changing one habit at a time. First, she shifted more of her fluid intake to the earlier part of the day. Then she chose one official bathroom visit right before bed and practiced staying in bed through the first mild sensations afterward, extending the time week by week. At the same time, she learned a few relaxation techniques and gentle bladder training strategies during the day. Within several weeks, she was down to 2 trips per night. A couple of months later, most nights she only got up once. The change was life-changing for her. She didn't get a new bladder. She retrained the one she already had. Another example is a man in his late 60s who was convinced his prostate was the only reason he woke up 3 or 4 times every night. His prostate was indeed somewhat enlarged, but his tests didn't show severe obstruction. When we explored his routine, we discovered he also had the just-in-case mindset. He would pee right before bed, then again when he walked past the bathroom, then once more after reading a few pages in bed, forcing out a few drops each time. We adjusted his evening fluids, reinforced proper sitting posture and relaxation when urinating, and most importantly, broke the cycle of repeated, unnecessary visits as he was trying to fall asleep. As he gradually extended the time between trips, his confidence grew. Combined with appropriate medical management, he reduced his nighttime visits significantly and felt much more in control. Here's the key message I want you to take away. Your bladder is a trainable organ. It responds to patterns. The number one nighttime habit that ruins your bladder for many people is not a single disease, not a single food, but the repeated pattern of emptying just in case and forcing the bladder to work when it's not truly ready. You are not weak or broken if you've fallen into this routine. You were trying to protect yourself, trying to avoid accidents, pain, or embarrassment. But now you know that this protection comes at a cost. The good news is that habits can change. You can begin tonight in a gentle, respectful way to send new messages to your bladder and your brain. Drink your fluids earlier in the day. Give yourself one calm, intentional bathroom visit before bed. Notice when anxiety, not true urgency, is pushing you to get up again. Practice staying in bed for a little while when the first mild sensation appears, breathing and letting your body relax. Over time, your bladder can relearn how to hold a comfortable amount of urine without constantly interrupting your sleep. As we close, let me leave you with a simple sentence. Your bladder is not your enemy. It is a partner that can be retrained at any age. You are not too old, and it is not too late to improve your nighttime habits, protect your bladder health, and reclaim deeper, more restorative sleep. If you recognize yourself in what I've described, consider discussing these ideas with your healthcare provider and exploring which steps are right for you. And if this message helped you see your bladder in a new light, feel free to share it with someone who is always waking up to pee and thinks there is nothing they can do. Thank you for spending this time with me. I'm Dr. Susan Parker, and I'm here to help you understand your body with clarity and compassion so you can enjoy more confidence, more comfort, and more calm day and night. If you'd like to keep learning about bladder health, longevity, and smart habits for the years ahead, you're welcome to stay connected. Leave a comment with your experience and join me in future videos. Your nights and your bladder truly can change for the better.